Jessica. Hi, everyone. Thank you very much, Jessica. Hi, everyone. My name is Esnat Sikazindu. I'm a 2020-21 AVAC Fellow. I'm doing a project on HIV prevention, focusing on PrEP among the adolescent girls and young women. I'm also doing the support of the introduction of the ring in Zambia. I'm being hosted by community-based TB, HIV, AIDS organization. So because of time, we won't all do the introductions, but we can just type in our names and organizations and what we're doing around HIV prevention. I'm so excited about this session because we'll be looking at the DVRA. And I've been working around the DVRA in Zambia, and it has been so exciting because the time that I introduced the ring to the adolescent girls and young women, they were so excited to hear about the ring. They were even saying, why didn't you bring it? We wanted to touch it. We just wanted to feel it. It just goes to show that women need HIV prevention options. As we know, the available methods have not yet reduced the epidemic. So we need more HIV prevention options that can help to reduce the HIV infection rates in our countries. So we've got some people who are going with someone from IPM who's going to be taking us through the research pipeline using DVRA, about purpose prevention and longer acting products. We also have an advocate from Zimbabwe who's going to be taking us through the approval, as we know that the ring was approved in Zimbabwe. And I was so excited when I saw that on the news. And I was telling my colleague, I was like, if Zimbabwe, they've done it, we can also do it. So we've got someone who's going to be talking about the approval, someone from Zimbabwe, the advocate. And then she's also going to be talking about the IOR outreach in Uganda. So I'll hand it over to Leonard, who's going to introduce himself and what he's doing, and also do the presentation. Over to you, Leonard.
Great, thank you, Esnat. Hi, everybody. Good morning and good afternoon. It's lovely to see so many familiar people on this presentation. And I was asked by my colleagues at AVAC to touch on the regulatory process for the ring and where it's at present, and then look at some of the ongoing supporting studies that are taking place. And then lastly, to speak about IPM's pipeline of products. If it's noisy here in the background, I apologize. It's hugely stormy in Cape Town today. So thanks for the introduction, Esnat. My name is Leonard. I look after product access and external affairs at IPM, and I'm based here in South Africa. So I know Jessica's helping me with the slides. If we can move to the first slide, please, Jessica. So before I start my presentation, I just want to read a disclaimer that the following slides provide educational information and background on several of IPM's investigational products. And although these slides contain some forward-looking statements, the monthly DVR and our follow-on rings, which I'm going to speak about, have not yet been approved by all national regulatory authorities. And some of the timelines I may speak about and the plans, of course, as we all know in this field that we work in now, are subject to change, and various factors influence our timelines. So we can go on to the next slide. Okay, the next two slides I'm sure you've seen in previous sessions, but I will touch on it quickly again. The next slide, please, Jessica. So this slide essentially describes IPM's regulatory strategy for having the ring registered in African countries. So as we have all followed in the past, IPM received a positive scientific opinion from the European Medicines Agency, the EMA, in July last year. You'll remember that IPM submitted under a procedure called Article 58. And we note that we were all excited about this. And while this is a critical step in the regulatory pathway for the ring, this step doesn't get us all the way there. A crucial step, of course, for getting the ring into the hands, or I should say getting the ring into the vaginas of the women who the ring will benefit most, is having approval by the national medicines regulatory authorities. So very excitingly for us, the WHO, World Health Organization, and great to see Michelle on the call as well. Hi, Michelle. The WHO, who participated in the EMA process, also issued a pre-qualification for the ring in November last year. And then a recommendation earlier this year from the WHO followed by inclusion. And then in July this year, we had the ring included in consolidated guidelines for ring use. So which was a really, really exciting step for the ring. The WHO also has an extremely useful mechanism, which is called Collaborative Registrations Procedure, or we refer to it as the CRP, under which products can be speedily approved. And as we all appreciate, products have been taking really long in many of our regulatory authorities, but through the CRP, the approval time is expedited. So IPM submitted to many African regulators under the CRP process, and we're anticipating hearing from many of them extremely soon. As you've seen the announcement by the Medicines Control Authority of Zimbabwe, the MCAS, who announced to the media last week that the ring has been approved for use in Zimbabwe. And this has been really exciting. I also want to mention with approvals, we also would like to work in conjunction with the Ministries of Health, when announcing, because it would also be important from the ministry side for them to also speak about what their plans are for ring introduction in country. Because there are many expectations and people have been following the ring and ring clinical trials for many, many years. And with all the work that all of us have been doing on the ground and what advocates have been doing, people have been waiting for the ring. We've been speaking about delivering ring for a long time. So can we go to the next slide? I want to share the WHO recommendation. So the recommendation from WHO reads, the Depiverine vaginal ring may be offered as an additional prevention choice for women at substantial risk of HIV infection as part of combination prevention approaches. And I have a little asterisk at the bottom of the slide where substantial risk is defined. Substantial risk of HIV infection is defined as HIV incidence greater than 3 per 100 person years in the absence of oral PrEP, in the absence of PrEP. We also know, and we all know this result as well, that the ring's efficacy is around 30%, and we know the efficacy of oral PrEP when used as directed is extreme. We can go back to that previous slide as well. It's fine. We also know that oral PrEP efficacy is extremely high. We also know with condoms, the level of HIV risk reduction is also extremely high. So I think when rolling out the ring and when messaging, it's important that we are very clear when we talk about the efficacy of the ring that we've seen in clinical trials, but also the efficacy that we've seen in the open label studies. Another message is we know that when the ring is used consistently and when there's good adherence, that we find that risk reduction of HIV infection is reduced even further. Thanks, Jessica. The next slide, please. So I'm going to briefly mention 3 of the studies here because I believe there may be more details during this presentation on some of these studies. So even though some 250 studies have been done on Depiverine ring from preclinical stages right up to the open label, there are still some research gaps, such as insufficient data on ring in young women aged 16 to 25. And we know in the studies that we showed very poor efficacy in this age group, and hence the REACH study was done. And the REACH study, some of the data was presented at the IAS, and the REACH study assesses ring safety and use among women 16 to 21 years of age and they looked at young women in South Africa, Uganda, and Zimbabwe, and it started in February in 2019. And it would be really, really interesting when the study is completed and we have all the data, because it also addresses the choices that young women made in the study, whether they chose oral PrEP or whether they chose Depivirine ring, and the reasons why they chose to use those products as well. Additionally, we know that there's insufficient data on ring safety and acceptability for pregnant and breastfeeding women, and we know how vulnerable pregnant and breastfeeding women are to HIV infection. Hence, 2 studies are being conducted. The DELIVER study is assessing safety and acceptability of ring in pregnancy in Malawi, South Africa, Uganda, and Zimbabwe. And then there's the Be Protected study, which is focusing on safety and acceptability of ring use in breastfeeding women. So these studies will also present, will bring to light a whole lot of exciting data, because as you know, at present, the ring is not recommended for pregnant women or for breastfeeding women, because we do not have sufficient data to ask regulators to approve it for those groups. We can go to the next slide. So while we have the exciting 1-month ring, the Depivirine 25 milligram ring, and IPM and our partners working with Promise and various other partners to roll ring out in country, our product development team is working on follow-on rings. Firstly, to building on the monthly ring that we have, we're looking at longer acting rings, which of course would have definite advantages such as lower annual costs of the ring and also increased convenience to women. Hence, the IPM's 3-month ring is in phase 1, and the results have been really, really promising. So the 3-month Depivirine ring contains 200 milligrams of Depivirine, which would mean a 3-month ring. You only need to have 4 rings per year. It would make clinic visits much more, which would make it much more convenient, but also convenient for the woman as well. And we are hoping that it would bring down the cost of the ring substantially. At the same time, IPM is looking at a combination ring, which contains Depivirine, as well as the hormonal contraceptive levonorgestrel. So hence, looking at the combination, we can see it's going to be both HIV prevention and contraception. So far, 2 phase 1 trials have been conducted. And from these phase 1 studies, the results have been supportive of further development of these rings. But however, I have to mention that some participants in the study reported slippage. So IPM has gone back to the bench and looking at reformulation of the rings, and a phase 1 trial is planned for 2021. We can go on to the next slide. That was my last slide. So I would like to acknowledge IPM's donors, and I'm happy to take any questions in the chat as we move on to other discussions, or I'm not sure how Esnat would like to move forward. Thank you.
Thank you very much, Leonard, for the powerful presentation. So we are going to go to the next presenter. So if you've got any questions, you can feel free to type them in the chat box. You can actually, because we'll have a discussion after we are done with all the presentations. So feel free to type your questions in the chat box, and then we'll go through them. Thank you. So we're going to have Anna, who's going to take us through the approval of the ring in Zimbabwe. Anna, you can take it up. Unmute your microphone and take it up. Thank you.
All right. Thank you very much, Esnat. And I also want to say thank you so much to Leonard Solai for that very informative presentation. And a special thank you going out to AVAC for the literacy research literacy zone, because it's always very important, because sometimes you feel like IAS and other conferences have a whole lot of science, and it's always good to break down the science and, you know, have an informal discussion like what we are doing. So my name is Anna Miti. I'm a 2015 AVAC Fellow for Advocacy, and I'm also an IAS Cure Research Advocacy Fellow. I work with the Humanitarian Information Facilitation Center in Zimbabwe. We work with journalists trying to break down the science and get them to network together with researchers and advocates and other people. And I also work as an advocate in terms of adolescent girls and young women and SRHR, of which HIV prevention is one of those things. So my point of departure when we're talking about the ring, I'm going to start off with what Leonard mentioned, which is the REACH study, looking at adolescent girls and what their preference is when it comes to the ring and other HIV prevention methods like PrEP. For example, it was just comparing PrEP and the ring. So Leonard mentioned that there wasn't enough information or data about whether the ring is safe or whether it's efficacious for adolescent girls from, looking at from maybe 16, 17, 18 to 21 in the previous studies that had been done, like Aspire and the Ring study. And I remember I was one of those advocates who was adamant that, there is need to research more. Why is it that, the ring that is supposed to work, there was no data that showed any difference between those girls who were on the actual ring and those who were were not on the ring. And so there was that talk to say it probably doesn't work. And I remember traveling to the NIH to lobby for this REACH study to be done, to be conducted, so that we actually had data. And the preliminary results that were shown, a couple of days ago at the IAS was showing that actually this 16, 17, 18 to 21-year-olds, actually some of them prefer the ring. And, we are waiting, of course, for the results to show us the rate of efficacy. But, just that for me, it shows that the ring, yes, it's something exciting. It's a tool that even girls as young as 16 and 17 would say, I actually prefer to use the ring. And that's actually for me very exciting. As exciting, I guess, as it is hearing that the MCAS, the Medicines Control Authority of Zimbabwe, has approved the ring. So that was quite exciting. But I have to say that I'm cautious, optimistically cautious, because I do understand that whenever something new is announced, when it comes to real world settings, it might take longer than we think. Yes, we are excited about it. And Leonard, like he mentioned, we are still waiting for the Ministry of Health and Childcare, as well as the National AIDS Council, which is the coordinating body for the HIV response in Zimbabwe, to give us a statement, which would then look at things like, how is this ring going to be getting to the hands or the vaginas of those who need them? How is this ring going to be distributed? How much is the cost? Where are they going to access it, and all those things? So we're still, cautious because we know it may take a bit of time. I remember in 2016 when we were so excited about PrEP, but it was only up until 2018 when you could walk into a clinic and say, I want PrEP. And I'm so excited because just a couple of months ago, I actually had to work with someone who was being initiated into PrEP, and I have to say, it was a very smooth process, no cost. We went to a local primary health care center, walked through it all, and in an hour she had been initiated onto PrEP. So that's for me, it's a long journey, but once we get those logistics done, I know we can definitely get the product to the women. So 3 things that I want to mention. Yes, excited about the approval, but we still have a lot of questions that need to be answered. So the real work for me actually begins now, because now we want to say, okay, so where is she going to get this ring? At what cost? Is it going to be medicated, non-medicated? Can they go to a clinic? Can they go to a pharmacy? And who is actually going to access this? Looking at things like hidden costs, such as transport, other hidden things such as, healthcare workers themselves not being confident enough to prescribe the ring or even to recommend it, and all those things that need to be worked out. So that's where the real work begins. Then the other thing is just to ensure that people know about the ring. I've done a lot of work around making sure that girls know about it. We've done talks at tertiary institutions, different youth groups, and it always surprises me that, since we've had PrEP, every time we open up the discussion,
Hello, Anna. Can you hear me?
I think we've lost her.
I think Anna, yeah, we have lost her. I think Anna has got a problem with the internet. So pardon?
I think we've lost her.
Yeah, we've lost Anna. So if there are some people who've got questions from the presentation, which Leonard took us through, you can unmute your microphone and ask your questions while we are still waiting for Anna.
So Esnar, I actually had a question that I think could really go for others, but I'm wondering if there's thoughts around the messaging and how advocates are thinking about the preparing for scale up of the dapivirine ring. And one of my questions was just this idea of, is there messaging around the potential that it could be a benefit in the time of COVID that it's monthly? And so as you think about scale up, is that playing into any of the messaging that's going on?
Jessica, maybe I'll take a stab at dispensing of medicines during COVID. What I've noticed, and this is from a South African perspective, and it's probably similar in countries in the region, that clinics, because people are not allowed inside public health clinics, they are pre-packaging medication, so they're dispensing medication for, maybe 3 months or 6 months at a time. So we also know that with the ring, we're hoping that when the ring is being dispensed, end users or consumers will be given 3 rings at a time. So I think it would, yes, during this time, it would really, really be a benefit. But it'd be good to hear about how medicines are being dispensed during COVID in the region as well, maybe from our colleagues in Zimbabwe or Uganda or anywhere.
Hello, so sorry, my internet is actually bad. Hello, can you hear me?
Yes.
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 So Esnar, now we can't hear you if you actually are communicating, but maybe I'll just take a minute and while you get back on to say that Manju, you have your hand up. So please go ahead.
So first of all, great that we have this session and really happy to hear from Leonard and from Anna about it. And it really is exciting to see, to hear about the Zimbabwe approval. I guess my question is to both Leonard and Anna a little bit differently. Leonard, in your perspective, once we get the final approval from the MOH, what are the most critical activities that will happen from a regulatory, manufacturing, from your perspective as IPM, what are the most critical things that need to happen in the next 2 months? And from Anna, I hope that you are able to come back to us, and your internet gives you support. Maybe from your perspective, Anna, you talked a little bit about the things that need to happen, but I'm curious who you think needs to be involved that hasn't currently been discussing and engaging from a community perspective, because we know there've been advocates who've been following it, but what do you think, Anna? Now, once MOH gives final approval, who do we need to make sure is included in the discussion? So for both of you, and thank you.
Anna, you're welcome to go first.
Okay, I'll go first. Sorry, my internet was just a little bit iffy there, so I'm going to remove my video. Apologies for that. I think the bandwidth will support me a little bit better. So one of the things that I realize is that as much as we've had advocates who've been really talking about the ring, and yes, the Ministry of Health has been more or less supportive in terms of, just the fact that sometimes we have meetings and they do come. We have the National Coordinating Body, which is NAC, the National AIDS Council. And the National AIDS Council has different mechanisms in which they get information out there to people. They're even involved, in the distribution of art, as well as PrEP, and also even in ensuring that whatever the ministry comes up with as a policy, they have support. They are the ones who are actually on the ground and ensuring that even communities, even people in the grassroots, even healthcare workers, they know about it. So for me, I think it's critical to engage NAC because they are the ones who've got the distribution mechanisms. They should know how to do it. They already have experience, with the whole thing. Even when PrEP started, they had the experience to say, okay, this is how we run our campaigns. They've been involved in, for example, the male circumcision. So they already have those mechanisms of, like, for example, the road shows. They have even up to, we have got provinces, then we have districts, then we've got wards and villages. They have a coordinator at all those different levels. So they should be able to use already existing mechanisms to be able to, get the ball rolling in terms of getting it out there. But of critical importance, and I know I was in a session yesterday where Jeff from PZAT, which is one of the organizations that are looking at rolling out the ring, she said, healthcare workers are a very important component because they are the ones who, when you walk into a hospital, a primary clinic, a healthcare facility, they'll tell you that these are the options that are there, and they need to be confident enough to prescribe the ring for you if you test negative. They should be confident enough to recommend it to you. So, and unfortunately, we have a lot of structural issues like, wage disputes with the healthcare workers. Sometimes they feel overworked, and sometimes they feel they don't have enough training. So we need to engage them as well. So for me, it's NAC and healthcare workers. Those are very, very critical. We need them. We already have work that is ongoing regarding communities. So, and already there are other, places and ways that we're getting to communities. So for me, those are very, very critical components.
Thanks, Anna. So to answer Manju's question following on from Anna, I also wanted to mention via PZAT, the Zimbabwean ministry has been implementing a lot of healthcare worker sensitization. Apparently, they've covered 3 or 4 provinces already, especially because of what Anna has said with healthcare workers not being able to adequately have enough information when prescribing. I think there's something they've seen with oral PrEP, so they don't want a repeat of that with the defibrillin ring. So it's great that they have embarked on sensitization and training at this early stage. From an IPM side, after regulatory approval, there are a number of things we still need to do. Of course, there's a pharmacovigilance monitoring system that would need to be in place, which IPM is working to put together a global system. where countries would still continue to monitor for safety or any adverse effects that they may see in users, and this gets reported back to IPM as the MAH, the marketing authorization holder. So from the MCAS in Zimbabwe and from regulators in other countries, we will receive a certificate saying that we are the MAH for Depivirine vaginal ring, and that's on the regulatory side. And the safety monitoring will be ongoing as long as the ring is being prescribed in country. On the manufacturing side, there are a few key things. As the demand for the ring increases, and we're hoping it does, we need to make sure that we are able to supply the demand, because the last thing we want to see is interruption in supply or any stockouts. And we've all been down the ARV journeys of seeing how this has happened far too often. So we're putting in many checks and balances, processes to ensure that supply runs really smoothly. IPM will be working with Chemonics. Chemonics is who work with USAID. They do a lot of the distribution of the treatment products as well as oral prep. So they will be assisting in those countries where USAID purchased the rings for distribution as well. So it's because the ring is not manufactured in many locations like many other products like oral prep, it is quite a balancing operation, because at the moment there's one manufacturer which is based in Sweden called Q Pharma. So the rings need to be manufactured there, packaged, undergo via good manufacturing practice, and then brought to the countries where the ring will be rolled out. So it's being slowly scaled up, and we're hoping that our manufacturing plans are matching the demand for rings. And it's heartening to know that regularly we are hearing of planned projects in many countries where we've worked. Thanks.
Thank you. Thank you very much, Leonard. So Anna, back to you. I think it's very important, Anna, we learned from you, Zimbabwe, how you manage to have the ring approved, because some of us, we are still pushing for the DVR agenda. Maybe you can try to share with us the strategies, the mechanism that you used to make sure that the ring has been approved in Zimbabwe. Anna.
Well, I don't think there's one simple answer to say we did A, B, C. What I know is in our country, as much as we have a lot of issues, even our healthcare systems, there are a lot of things that need to be fixed. One of the things that we've managed to do, and it's a lesson learned for even other countries, is to have a coordinating body that does almost, that is involved in almost everything when it comes to the HIV response, and that is the National AIDS Council of Zimbabwe. So it's quite easy to lobby for things like that, because you've got a go-to place, you've got somewhere to go to. Unlike in other countries where it's a little bit fragmented, someone is doing the male circumcision, someone is doing PrEP, someone does art, and it's very difficult to get them together. So the National AIDS Council it's easier for us as advocates because we've got a go-to place. And I think we are also one of the first countries to acknowledge HIV in Africa. I remember when President Robert Mugabe came out, which you can say, and think anything about Robert Mugabe, but when it comes to HIV, the fact that he declared it as an emergency, and it made everyone aware of HIV. It made everyone want to be part of the solution. It made everyone, every other aspect, whether you're looking at even other line ministries, they then had something to do with HIV. So I think that has been our biggest advantage. And then we do have quite a number of people who are very passionate about issues of HIV, mainly because, yes, like I said, when something is declared an emergency in a country, you want to also be seen to be doing something. So that has helped quite a lot. Also in terms of the MCAS, our regulatory authority, there's the MCAS, there's MRCZ, the Medical Research Council of Zimbabwe. They've had a lot of lobbying for being done to them by advocates. And we've also had a lot of these studies that were done here in Zimbabwe, where they're looking at as recent as, the cabotegravir and the slatravir trials here in Zimbabwe. You're looking at Deliver, you're looking at even Aspire and the Ring studies. They were also done in Zimbabwe. So they already had that information, when the researchers submitted the dossiers for the research, they already had that information. So I think it was easier for them now as MRCs and as MCAS to say, okay, we already have the background information and we know the studies were done in Zimbabwe. So it was easier, I guess. So yeah, there's no simple answer, but I can say in terms of recommendations, get the voice of the women, the young women themselves, or as the end users, because we have also involved them. Even when we have meetings, we ask participants who are part of the studies to come through, and the Ministry of Health or whoever the officials who are there, they actually hear from the women's voice themselves to say, okay, this is what we want, this is what we think about the ring. And so that has been also very, very useful. I think that's something that other countries can take note of. It's important to have the voice of the end users. Yeah, thanks.
Thank you very much, Anna. So if anyone has a question, you can feel free to type in the chat box, or you can unmute your microphone so that you ask the question to Leonard or Anna. Let's feel free to ask questions. So maybe you can share your experiences, how you're preparing your communities. Yes, Manju.
I always have questions, so I'm happy to stop asking questions. The way to get me to stop asking questions is for everybody to ask questions. So if you don't want to hear my voice, please ask. The question I'm asking is to others on the call. I'm really curious what questions you've been having from policymakers and others as the advocacy is continuing in other countries to get regulators to look at the submissions and come through. Are you hearing any pushback? Is it because of the ring itself? Is it because everyone is focused on COVID? So I see that we have folks from South Africa on the call, from Uganda, and other countries. So and of course Zambia. So I guess I'm curious about other people's experience in this era now when we know we're waiting for approvals.
Hi, Manju. This is Neetha here. Hi, everyone. So for us currently, access to products is a discussion, especially based on the COVID vaccine experience, where, as everybody is aware, access is a challenge. I mean, 2% of the African population is vaccinated. So with the ring, there's acceptance, and women have asked us when they will get it. But as Leonard presented, because of the delay, we do not want to create an expectation, but at the same time, we're ensuring that there's advocacy and encouraging demand, not just for ring, but for future products that are efficacious. So that's what I can say for now.
Okay, thank you very much for the contribution. Here in Zambia, it's because of COVID, we are having challenges. I'm sure it's because of COVID. The situation is so bad. It's very, very bad. People are dying every day. It's a time when you call someone from NAC, someone from MOH, they will tell you we are still having meetings, we've postponed, so we'll get back to you. But right now in Zambia, MOH is they're developing protocols, and they've come up with a task force that will start working on the DVR agenda. So they are going to do a demo study, but we haven't yet been given more information because PEPFAR said they're ready to fund the ring, but they're waiting for MOH. That's a question that I asked PEPFAR, but they still referred me to MOH yesterday when we had a PEPFAR poet meeting. So it's something that is a bit slow and something that as advocates we are pushing, because women are ready and they want the DVR. Like I said, the time that I was introducing the DVR to the adolescent girls and young women in my country, they were so excited and they were asking me, when is the ring going to be available? They had so many questions because not one size fits all. If something, a product can work for me, what can work for me is not something that can work for another person. So women are geared to have the ring. They really want to try the ring, to use the ring. Thank you. So maybe we can have someone also to share their experience from their countries. Or you can just type in the comment if we are feeling shy to unmute and say something. Hello? Hello?
Hello, this is Margaret from Zambia CBTO. I just have it's a question or a statement, but for those people that are researching, people are also looking at the efficacy levels. They want the ring, but they are saying, please increase the efficacy level. Let it be at least 90, 80, 90%. If it's possible for the scientists to reach that level, it will actually be something which is very, very, very good. Because as you have heard in Zambia, people would rather go for that than go for the PO, than go for PrEP. So the researchers, if they can look at the efficacy levels, that would be very, very great for the ring. Thank you so much.
Thank you very much for the question, Margaret. So Leonard, maybe you can take it over.
Hi, Margaret. Thanks. That's a really good question. And also to mention, as I said in the presentation, the ring, as we've heard from the EMA as well, the ring should be prescribed where oral PrEP is not available for use or can't be used by the woman. And it's also important that that good education is done and that the more efficacious product, of course, should be offered. But we all advocate for choice and options. And we all know that people can't use oral PrEP. You know, at people's different times in their lives, they want different options. To your question about improving the efficacy of the ring is a non-systemic product. As you know, the dapivirine in the ring is just localized mainly in the vaginal tissue, and a very little bit of the dapivirine goes into the body, unlike oral PrEP, which is systemic, and which of course means that the efficacy would be greater. And we know that the ring could never be as efficacious in the 80s or 90%. So the only way we get the efficacy up in the ring is for the ring to be used as prescribed, you know, for the ring to be left in continuously for 28 days and then changed with a new ring. And we know from the studies that improved efficacy to over 50%. But we must also remember in the early oral PrEP studies, when the results came out, the data showed that oral PrEP efficacy was in the 40%. And that was, you know, because the product wasn't used as prescribed. So we know efficacy for ring could increase, but I can assure you that it wouldn't go as high into the 80s or 90s. And we know that sub-analyses were done, you know, looking at the research data where they excluded non-adherent participants in the studies, and it pushed up the efficacy of the ring. But we can only talk about the ring's efficacy and the correct efficacy numbers as to what the regulators have approved on. So at the moment, it's around 30% efficacy. I hope that answers you.
It does, yeah. Thank you so much.
Very much. Do we have anyone with a question? Anna, you want to add something?
Yes, I wanted to add something in answer to what Margaret is saying. So as much as, yes, I do understand people want the whole 90% like PrEP and all that. One of the most it's most accessible because, you know, it can even be distributed in clinics for free, is the condom. We know the condom, male and female, it protects against STIs, against pregnancy, and also against HIV. But if you go around and ask people, you know, if people were being honest, as much as that is the most accessible and it solves almost all of their problems when it comes to SRHR, people are still not using the condom. And there's a reason why. They have their own different reasons there. So what it just basically shows us is that even if a project was 100% like abstinence, there are people who simply are not able to do that. So when you're looking at the ring, and when we look at communities, we always say that you have a choice of not using anything at all. You've got a choice of not having sex at all in the first place, abstinence. You have a choice of using PrEP. And, you know, now with the new studies, of course, they are not yet available, but people are going to have a choice of having an injectable, which is cabotegravir, a 2-month pill, islatravir, and all those things. So it will end up, you know, being about choice. So we're saying it is better to have that 30% at the very lowest than nothing at all, because you know you have reduced your chances of getting HIV. So it's an option that for those women who say, PrEP, definitely I can't get it. I can't get my partner to use a condom. Definitely it's not going to happen. I'm not able to abstain because sex is my life, it's my work, I'm a sex worker. So here is something that is an option on a, you know, with all this basket of options. It's better to have that something than nothing at all. You look at, for example, the male circumcision, which is 60% effective, according to the studies, and that's, you know, 60%, but it was rolled out, and men have that option. If you want to not use maybe a condom, if you feel like, okay, I don't want to use a condom, but I want a bit of protection or a bit of assurance, then you can have the male circumcision. It is the same thing as the ring. We know that studies have shown that it can be way higher than 30%, like Leonard is saying. So it's an option that is there, that's, you know, it's extra for someone. Imagine if you had maybe 10 chances of getting HIV in whatever number of sex times you have had, and then you manage to reduce from those 10 times to maybe 3 chances. That's actually quite a lot, and it actually does change the life of a lot of people. So that's why this ring is very important, and also because of that fact that it's within the hands of this woman. It's the women-controlled device that we know does not need the cooperation of a man apart from PrEP. So for me, that's something that is huge when it comes to HIV prevention.
Thank you very much, Anna. I think the question that I would want to ask Leonard is something that kept on coming from the adolescent girls and young women. So they asked, what happens if someone who's pregnant or someone who's breastfeeding uses the ring? Leonard?
Hi, Isnat. So yes, thank you. That's a very important question. So as we know, the 2 studies that are taking place, the Deliver and the Be Protected, those studies will certainly provide answers on the safety of the ring in pregnancy and breastfeeding. At the moment, we don't have enough data to support pregnancy or breastfeeding. So it will not be on the label, you know, like the package insert that goes in with your medicines. It will not say the ring is safe for pregnant and breastfeeding women. However, once we have that data, and if the data shows that it's safe in pregnancy, it's safe in breastfeeding, of course, we can apply to the regulators to have that amended. But at the moment, no, we cannot say, so we will not put infants at risk. I also want to mention, though, and as a learning, that during the trials, so all the women in the studies were on stable contraception. However, there were occasions where study participants became pregnant, and they were immediately stopped. They were stopped from using the ring, and then they continued, but they were followed up to see that they were fine, and they came for their visits, and then they also followed up the babies after the women gave birth, and there were no safety concerns detected. But this was inadequate numbers, to say that the infant is safe. Hence, these two big important studies are being done.
Thank you very much, Leonard. Just another quick question for you. It came the time that I was introducing the ring to the adolescent girls. They were asking about oral sex. Does the ring protect someone who's from HIV who's doing like oral sex? So just explain a bit on that one.
Maybe I'm going to ask one of my colleagues who's in the group here, seeing that we are having an informal discussion, to unpack that question and how would somebody answer that question. It's a very important question. So I can ask even Manju or Anna or
So Manju, do you want to take that one? Or Anna?
Let me try. And then, but actually, Leonard, I mean, but we need some clarification. So from my understanding, we have not done, there is no research that specifically has asked that question. However, there is very, very little, I mean, well, the drug itself dissipates into the tissue. So we first of all don't have to worry about anybody who engages in oral sex as the person who's receiving it is safe. But the person who is performing it, we don't have to first of all worry about them getting drug, and that's a good and a bad. Good because in case they're allergic or anything, but it's not protective to them. But oral sex is a very, very low form of HIV transmission. So although the question is relevant and it's good the question is being asked, in general, from an HIV education perspective, it is on the hierarchy of safe sex. It's very, very safe form. Nothing is completely safe, of course, only abstinence, but it's a pretty safe form. So enjoy and try not to be too worried, is what I would say. But I'd love to hear what Anna would say, or others, or if I'm hitting your right message, Leonard.
No, that's why I asked you, because you answered it better than I could. And that is, and you explained it and I love the message about the safety aspect around oral sex. But just to iterate that the amount of dapivirine, even in vaginal fluid, is very, very low. So the ring has 25 milligrams of dapivirine. And at the end of the month, when the ring is completely used, there's around 21 milligrams still left in the ring. So you can imagine only 4 milligrams has left the ring over the month. And it's all mainly in the vaginal tissue. But thank you,
and I just want to add that's a question that I've also received quite a lot of, which is something that for me, two things. The fact that the young women are quite confident to ask that question, for me, that's a good thing. At least they're thinking about it. And second, of course, I do support what Manju is saying in terms of the answer. Usually that's what we also, just say. But of course, we know that there are other things that oral sex can also give you, like, herpes. But in terms of HIV, yeah, not really something that you should be worried about quite a lot.
Thank you very much. So does anyone have a question? Because we're almost winding up because of time. So if no one has a question, then I'll ask Leonard to just give us the last words. Leonard.
Thanks, Esnat, and it's really been good having this discussion. And I know Manju organizes, and we work together, of course, to have quarterly meetings. Just to mention that as we have regulatory approvals coming through, that we will be sharing with all of you, but the support from the advocacy community has been great over the last many years for the Pavilion Ring. So we really appreciate your work and your support and commitment as well.
Anna, can give us the last word. Thank you, Leonard. Anna.
All right, so my final remarks is that I'm just so excited that we have this horizon, this option on the horizon, and of course, well done to Zimbabwe. I'm really proud of my country. There's not a lot of things to be proud about at the moment, but just that fact that this is something that they're working on and ensuring that it gets to those who need it. I'm very, very excited about it. But I know that there's a whole lot of work that still needs to be done. And I continue to support the work. I love it. I love the fact that, we can engage with adolescent girls and young women about SRHR. And, there's been this impact where, somebody is actually saying, okay, we need to do something about this when it comes to adolescent girls and young women and HIV. So that for me is great. And lastly, just want to thank IPM, thank AVAC and everybody who's been involved in the work around, the ring, the researchers. I know it's been a labor of love, especially for researchers like Dr. Mgodi, who've been working since 2014, 2015, all those years. So yeah, pom pom for them, and yeah, looking forward to great things coming through.
Thank you very much. And now, Leonard, it has been a very powerful discussion. I'm sure we've learned a lot of things. Jessica, do you want to say something? Or Manju, before we close?
I just want to say thank you all for your participation. I know that the conferences are always, they can be long, but we really appreciate having everyone here for the conversation. Just really appreciated hearing the updates from both Leonard and Anna. Just your excitement and passion for the ring moving forward has been both really inspiring and appreciate it. Thank you.
Thank you for joining. For now, bye. Thank you.
Thank you all. Bye.
Thank you so much. Bye.
Bye.